Hey guys, I'm Katie. I'm the Dance and OT. So just to introduce myself, my name is Katie. I've been an occupational therapist for 20 years. I'm NDT certified and CPAM certified, and I usually lead a weekly OT dance group. I've done this in skilled nursing. I've done it in acute rehab as well, and it's a very popular group and it works well with a whole different group of patients and diagnoses. It's something everybody can enjoy. So I'm going to explain a little bit about the group and what we tend to address in the group. The objective of the group is to increase rhythmic coordination, muscle timing, and control. There's a lot of theory about how the body calibrates movement with different rhythms. There's different treatment modalities such as interactive metronome and different things like that are based upon this theory. We can increase bilateral coordination, coordinating both sides of our body and both hemispheres of our brain together, doing like or different movements at the same time. We can use dance to increase our body schema awareness and proprioception. We can provide an activity that provides the ability for the patient to cross midline, again involving both hemispheres of the brain. It will increase visual awareness, not only of their own body and the patients around their bodies. It will also increase visual awareness as they watch the instructor lead the group. And it will provide an opportunity for patients to improve their cardiovascular endurance. It will increase the patient's ability to follow multi-step directions, which is a good cognition group as well. It will provide an opportunity for peers to interact in a group setting. And it will provide an opportunity to use all extremities and core in a functional way. So this is a really good group. So if you're an occupational therapist leading this group, obviously you're going to have 2 to 6 members. You want to set it up so all of the footrests are removed, and if possible, remove or swing back the armrests so the patients aren't going to be, bumping into the armrest, getting skin tears and bruises and whatnot. You want to make sure that every patient is arm width apart from the other patient's hands, because we're going to be doing a lot of movements. We don't want the patients to be hitting each other, obviously, so make sure that they have a nice kind of a bubble around them where they're not going to bump into anything. We want to make sure that the therapist leading this group or the activity leading this group, that there's a chair or something nearby where you have copies of all of the different movements that you're going to be doing, and also access to your music. So I always have a chair next to me nearby. You want to make sure that you offer different modifications to all the patients in your group. So you want to be aware of who's in your group and what diagnoses that they have. Lots of modifications can be made. So if a patient has an orthopedic limitation, total hip replacement or something, or cervical precautions or sternal precautions, recent pacemaker or any of those precautions, be aware of that, because you can make modifications to all of these movements so that they're going to maintain the precautions but still able to participate in the group safely. If a patient is hemiplegic, if they have enough movement in one of their arms and it's a little bit hemiplegic, they can do the group and just do it the best that they can with that side. If you have to, you can have them modified, use the other hand as a helper. If not, you can have, if somebody's completely hemiplegic and they can't move at all and we're doing something alternating arms, so you can maybe modify it and have a patient just use the one arm twice instead of alternating back and forth. If they're missing a limb, similar thing. If they're in an orthopedic brace where, say we're doing a leg kick and a person has a long leg immobilizer, you can just have the patient, do the same thing, just kick the other leg twice in its place. If a patient is off timing, that's okay. Just encourage them to continue going and just pick up the movement as well as they can. If they're off timing from the music and that rest of the group, that's okay. Encourage them to continue participating. Always make sure that you pay attention to what's going on in the group, and you get a pitcher of water ahead of time. This is a pretty tiring group, and a lot of patients might get tired or thirsty or need a drink in between. So have a pitcher of water nearby, but also be aware if any of your patients are on thickened liquids, if they're NPO, if they're on a fluid restriction, be aware of all those things as well. So some other benefits from this group. I started dancing a few years back And I noticed that when I started dancing, I felt better, I would sleep better, I was in a better mood, I felt like I was less clumsy, I felt like I was more coordinated. There's a lot of benefits that dancing can bring, but one of the best benefits is it's really fun. It's definitely a lot funner than repetitive exercise. You know, it's done in movement, so you don't really feel like you're exercising even though you are. And also there's something very nostalgic about music and dancing, which is great. It brings a lot of patients back. And in this group, I use a whole variety of different genres of music and different decades of music, so there's something for everybody. So hopefully that would be a good thing, you know, and everybody can enjoy something. So I don't own any of the rights to any of the music that I'm using. We're just doing this for some good old fun and to get our bodies moving. So whether you're a patient that's watching this and you just want to get some exercise in, that's great. All these exercises are done from the chair level, so you don't have to worry about anybody falling in your group. So that's an added bonus of safety. I don't own any of the rights to the music, obviously. I just said that. If you want to get in touch with me and have any questions, you can reach me at dancinot@gmail.com. That's dancinot@gmail.com. And I'd be happy to respond to you if you have any questions. So everybody should, before they go into the music sets, you should always watch this video at least one time so you can kind of have a better understanding of why we're doing this group and keep everybody safe and all the benefits that you can bring to your patients with this group. So, all right, let's get dancing. So we'll see you in a minute.